This presentation for the Early Childhood Voices 2022 conference is entitled Early Childhood Professionals' Knowledge, Beliefs and Practices when Supporting Children Suspected of Communication Disorders. And I've worked on this research with my team, Nicole McGill, Laura Hoffman, Tana Cuming from Sturt University, and our colleague Anna Cronin from Australian Catholic University. So to give some background to this research, we know that early childhood professionals, which includes early childhood educators and maternal child health nurses, among others, are key referral agents for early identification of communication disorders. However, very little is known about the current understanding and actions made by these professionals when they suspect a child of having a communication disorder. So why does it matter that we identify communication disorders early and provide intervention as early as we can? Well, a huge body of research has shown the far-reaching consequences of having a communication disorder in early childhood. And these include difficulties learning to read and write, difficulties forming friendships with family and friends because children may not be able to express themselves, difficulties with self-esteem because children may not feel heard, which can lead to difficulties with mental illness, difficulties achieving in education, and difficulties attaining employment later in life. But the good news is that early identification and intervention for these communication difficulties does have the potential to significantly reduce these negative long-term outcomes. Now, there are a number of key professionals that children might encounter in their early years who could be agents of referral. And these include early childhood educators, preschool teachers, maternal child health nurses, and a whole heap of other allied health professionals, including occupational therapists or social workers, etc. And while these professionals have really wide-ranging scopes of practice and also increased workloads, which results in time constraints and pressure, they still do have a really important role in identifying early childhood communication difficulties, albeit that is only one part of their very large roles. So for the theoretical framework for this research, we've drawn upon Bronfenbrenner's bioecological model of development. And this theory posits that interactions between the individual, who in this case is the child, and their environment, categorized into various systems, shapes their development over time. And so you can see from the model that the key adults in the children's lives, such as their early childhood professionals, have the ability to influence their communication development and their long-term outcomes. But there's still many gaps in our knowledge regarding our colleagues' understandings and actions when it comes to working with a child that they suspect of having a communication disorder. So our team wanted to answer the following 3 research questions to address this gap in the literature. First, we wanted to look at what early childhood professionals' knowledge, beliefs, and practices were in relation to supporting communication development, what personal factors impacted upon their knowledge, beliefs, and practices, and what actions they took to support early identification and intervention for children with communication disorders. Now, our data were collected via an online survey, which contained 41 open and closed questions. The closed questions were 19 statements, which you will see a little later in the presentation, about knowledge, beliefs, and practices. And participants were to rate their agreement from 1, strongly disagree, to 5, which was strongly agree. We also had a number of other multiple choice questions and questions regarding their demographics, so their level of qualification, etc. The quantitative data were analysed in SPSS. We used a factor analysis to reduce all these different 19 statements down into a 5-factor solution, which I'll discuss. And we then used a regression analysis to see what demographic factors were related to the different themes that came out of the factor analysis. For the qualitative data, we undertook a summative content analysis. So we had 540 participants in our study from Australia, which is quite a good response rate. We had participants from every state and territory in Australia across a wide range of age brackets. We had over 30% who spoke a language other than English at home, so it was quite a diverse sample. And we also had a range of qualifications, although it was quite a highly educated sample, with over 50% having a bachelor degree or higher. When we look at the different types of professionals, the main type were early childhood educators, followed by preschool teachers, and then maternal child health nurses, among other professionals. So I spoke about the factor solution that came from our factor analysis. And basically this that took the 19 statements that I'm about to show you and put them into 5 different categories. So this was the impact of early years upon long-term outcomes, play, pedagogy and supporting development, early language acquisition, roles and responsibilities in supporting language development, and supporting early literacy. So now we're going to look at how the early childhood professionals responded in terms of each of these different factors and what demographic variables were related to their responses. So in orange, you can see factor 1 is highlighted and the 3 questions that were within that factor are also there. You can see that early childhood professionals mostly agreed with these items. So there was a lot of agreement that the early years has a huge impact on long-term outcomes. Factor 2 was about play, pedagogy and supporting development. And again, early childhood professionals widely agreed with these statements. But when it came to factors that were specifically about language acquisition, early childhood professionals were more divided on their role. So there wasn't a lot of consensus on this item around what their role was, whether or not it was their role to teach language, and whether or not that was more of a job of the home versus at school or early childhood education. The same goes for factor 4. The early childhood professionals were more divided in whether or not it was their role to teach children to read and where the children were learning most of their language from, and whether or not they were confident in being able to identify children with language difficulties. Okay, and then in factor 5, most early childhood professionals agreed with these items, that they did read to the children in their centre daily, and that they were to teach the foundations of reading, and that they were confident in teaching these skills. So then we looked at what factors were related to this. Now, factors 2 and 3 didn't have anything really related to them because there was a large agreement in how people responded. But with factor 1, interestingly, those who sufficiently trained had received sufficient training answered differently to those who hadn't. Across all 3 of these factors, First Nations early childhood professionals answered differently to non-First Nations professionals, and this could be to do with cultural perceptions of early childhood and child rearing. And in factor 5, those with higher qualifications answered differently to those with lower qualifications, and those who could correctly define a speech disorder answered differently to those who could not. We then went and had a look about what the early childhood professionals would actually do if they came across a child that they suspected of having a communication disorder. And around just about all of them said that they would seek advice. As you can see, the rest were largely missing data in that question. But then it was very interesting when they said who they would go to. You can see that most of them would go to, you could see that only around half were in agreement of who they would go to. So around 55% said that they would seek help from a speech language pathologist. And again, in the second question, what action would they take? Again, only around 55% said that they would tell the parent to see a speech language pathologist, which was quite interesting from our perspective because we are a team largely of speech language pathologists. So what are the implications of these data? Well, early childhood professionals universally acknowledge the importance of the early years in enhancing outcomes and the importance of play in supporting early development. Where contention existed was in relation to their perceived role in supporting language acquisition and early literacy development. Personal factors such as level of qualification and training were significantly related to early childhood professionals' attitudes, beliefs, and practices in early identification and intervention. And so this gives us a sense of the fact that qualification and training might play a really important role if we're wanting to provide further education to early childhood professionals on being able to identify communication difficulties early. And to make sure that the advice that they're seeking and the advice that they're giving to families is evidence-based and culturally responsive. An interesting finding was that just 55% indicated they would seek support from a speech language pathologist, who are professionals that specialise in communication difficulties in the early years. So this identified to us a greater need for collaboration between professions to share information about early identification and to support children in the early years. We have another half of this project that's coming up, and the next half is actually looking at the parent's perspective. So using the Bronfen-Brenner model, we know that the different environments in which a child participates influence their development. So we've looked at that early childhood professional perspective. Now we're also looking at the parent's perspective to try and gain a larger picture of people's understanding and knowledge about communication development in the early years and what we can do to support children who are suspected of communication difficulties. And that second survey is being headed up by our lovely honours student, Lucia Flint. And we hope that the multiple studies in this project will really shed some light on how we can support early communication development in Australia. These are our key references. Thank you very much.